Santa Monica College, #1 in transfers and top job trainer on the Westside. Learn more at smc.edu.
So in Southern California, it is a bit of a concern year-round because we have wonderful, beautiful weather here. But mostly our snake season is going to be somewhere between April to September. When you're out on hikes, I highly recommend staying on the trail. I highly recommend keeping your dogs on leash. We tend to see a lot of the bites happen when the dogs are off leash. I do recommend making sure that you are looking ahead on the trail and also looking around you before you go up the trailhead, making sure that maybe 10 feet in front and you're not seeing any rattlesnake crossing your path. Is their camouflage. So it's very tough to spot them, especially if they're in the brush. So it tends to be if you see them or a portion of their tail along the trailhead is kind of when you spot them. However, they do often have rattles. So if you can hear the telltale sign of a rattle, maybe you should be looking a little bit more around and making sure you avoid certain areas, high brush areas and keeping straight on the trail. If you are concerned about a bite or you do see a rattlesnake and all of a sudden your dog is yelping in pain, what you want to do is go ahead, grab your dog. If it's a small dog, pick it up. If it's a bigger dog or medium-sized dog, if you can pick it up, that would be fantastic. And the reason why we would want to avoid having them run all the way back to the car, depending on how far it is there is going to be increased circulation. The more the heart is pumping, the more circulation there's going, so there's potential that that venom could circulate a little bit quicker. Get them to the car as quickly as possible, and honestly, the best thing you can do is go ahead and get them straight to a vet. About 20 to 25% of our bites are going to be what we call dry bites, meaning that they may not necessarily inject the venom, which is always great. Now, we will never know which one are going to be dry bites and which one are going to actually have venom in them until we evaluate them. So if there's any question of your dog getting bitten, sometimes they are going to need multiple vials of antivenom, and that's the only way to do it. Now, there are vaccines out there. The vaccine may actually decrease the potential seriousness of the bite. However, it does not prevent the need for antivenom. So even if your dog has had the rattlesnake vaccine, it still needs to be seen by a veterinarian.